Unfortunately, chiropractors don't realize that they are the experts. They're the absolute experts. They are the individuals who see the patients before uh, the insurance industry or the lawyers can corrupt that claim. And I don't mean that in a negative way so much as it's that lack of communication between the treating physician, the chiropractor, and the insurance industry or and the attorneys. It begins with the emergency room. And emergency room techs are absolutely a necessity in this society. But you will find, I'm sure you've experienced this, emergency room physicians deal with trauma and they look for blood and they look for broken bones, but they are not experts as the chiropractors are. So the first thing that is lost in this communication is the diagnostic stage, the initial stage. Unfortunately, we find throughout the country that, especially in California, you have med pay at what, $1,000 levels? So a lot of your communities are getting $1,000 in medical coverage. How does that afford the proper testing that needs to be done in almost every case? It doesn't. It doesn't afford for the treating physician as a chiropractor who comes in right after the emergency room tech and is supposed to diagnose, it doesn't afford that technician, that expert, to do an MRI. Because how does the MRI get paid for? Well, it can get paid for by health insurance, right? But a lot of people don't have health insurance, and a lot of people have thresholds that they have to pay before they can get their MRI paid for. But the MRI and the expert chiropractor is the perfect union of providing a complete and thorough diagnostic picture of what the patient actually experienced. And that's missing all over the country. X-rays, flexion extension X-rays, MRIs assist in objectively defining the diagnosis of injuries. And that's missing. So when that's missing, how does the insurance industry then say, oh, we're not dealing with just whiplash? You know, whiplash has become a pretty dirty name, right?
Yeah.
And honestly, so has chiropractic. It shouldn't be, because chiropractors are experts in diagnosing all of the injuries. They can go into so many different areas with the muscles, the tendons, the ligaments, the skeleton areas, the nerves, and identify so many other injuries. So the first disconnect, as where we started, was that we don't get a complete diagnostic picture of what is going on with this patient following an accident. So that can be improved. And then communicating that to the insurance industry.
So are you saying, and correct me if I'm wrong, is that it would be wise actually for the insurance company to allow a little more dollars up front so you can actually get the proper diagnosis as soon as possible?
Oh, absolutely. $1,000 med pay in California is ridiculous. I mean, it's absolutely, and it's not just California. There's over 15 states that have minimum limits for med pay. PIP is a little different. Personal injury protection coverage begins at $5,000. So it affords you more financial support to get the diagnostic intervention of uh, objective testing in identifying what's wrong with that patient. But that's absolutely, that needs to be changed. And hopefully somebody in California and Florida are looking at the ways of changing that.
What's the disconnect between lawyers and insurance companies that you have seen? Some are a lot. Some are a lot.
Oh, there's a huge disconnect between attorneys, plaintiff attorneys, who handle PI claims or work comp claims. Uh, those attorneys that handle those claims have been taught back in the 80s and the 90s that you receipt a client in, and then essentially you forget about them. You don't pay any attention to them. And even the intake of that client is not effective. But they have been taught or they have learned over the years that they simply intake clients, they wait for the treating physician to finish up the treatment, and then they submit a claim. Now, be reasonable. Think about this. If a client is seriously injured in an accident or even moderately injured in an accident, testing should be done. There should be x-rays, there should be an MRI, there should be digital x-rays, there should be objective testing to identify exactly what the injuries are. So that's not being done, and then you don't get diagnosis. If you don't have diagnosis, then you don't have injuries. If you don't have injuries, what is supporting the treatment? And if the attorneys are doing what they did back in the 80s and the 90s, just let the claim be essentially handled or even mishandled by treating physicians who don't do that diagnostic testing, you end up with policy limits available to satisfy that claim, to pay for the medical treatment, to pay for the objective testing, to be exhausted by treatment. Now, I'm not saying treatment isn't necessary, but we have to deal with real life facts. In California, you have minimum limits of $15,000. In Florida, you have minimum limits of $10,000. What happens if you have $7,000 in chiropractic and no testing? You have cervical, thoracic, and lumbar sprain strain being diagnosed. You have a treatment that is running up $7,000, $10,000. What is left to the patient and ultimately the client? And unfortunately, the attorney too, because the attorney gets 33 1/3 in most states of any settlement, right? So on a $15,000 settlement, the attorney gets $5,000, the client gets $5,000, and the doctor has to settle for the treatment costs as well as the testing costs for $5,000. That means that our clinical side, our medical side of this triangle is actually being damaged. I'm not sure what an MRI costs here in California, but I know it's expensive. But it's necessary. And if you don't have the MRI, you don't have the capability of proving objectively what the injury is, so the insurance industry can't place enough settlement authority on the claim, and the attorney can't settle the claim within a specific range. The disconnect by letting the claim just be handled on its own, standing by while the treatment is continuing to grow, and not get objective testing means that the insurance industry can't make a decent, fair, and reasonable offer on that